Welcome back. We are all taking precautions to protect ourselves from the coronavirus, but for people already battling diseases like cancer, those efforts get multiplied. Denver 7's Katie LaSalle sat down with Susan Ashley, the Vice President of Clinical Services at Cancer Support Community, as well as cancer survivor Chad Wheeler, and they're sharing some of the resources available to cancer patients and their caregivers.
What are you guys doing particularly to help patients and caregivers during this time?
Well, we launched the Cancer Emergency Fund to help people in distressed circumstances. This fund will enable us to provide financial assistance to individuals affected by cancer who have lost their jobs or need help with food, utilities, and other basic needs. It also allows us to keep our cancer support helpline, which is staffed by licensed mental health professionals and resource specialists, open 7 days a week. We also are making sure people know about the cancer community's digital platform, My Lifeline, which was founded right here in Denver. It is a free online platform specifically created for cancer patients and caregivers to help them virtually connect and expand their community. One feature that can really help cancer patients and caregivers right now are My Lifeline's online discussion boards. And those discussion boards are moderated by licensed mental health professionals and allow cancer patients and caregivers to share common experiences, stories, and inspiration. And we have seen people connecting all across the country on our discussion boards because in-person support and support groups are just not available to them.
That leads us into Chad. What for you has been the hardest part of coping with the spread of coronavirus?
Oh, it's just not only is there the inconvenience that happens at the clinic itself, they do a terrific job of trying to keep coronavirus out of the clinic, and one of the measures that they've of course done is if you're not a patient, you're pretty much not coming in there. So there's that inconvenience. But I would say the biggest part has probably just been piling on worry on top of what you're already worried about, and that's probably been the biggest part that we've had to try to overcome. Just trying to figure out, okay, if we do get it, what's going to happen? What are we going to do to try to avoid it? So it's just one more thing to worry about.
Sure. And Susan mentioned My Lifeline. Has that helped you really stay connected with the community during this time of social distancing?
Oh, absolutely, it has. It's just it's been a way for us to discuss, what we're going through, and what's interesting about it really is that I think we found that a lot of my family and friends that keep up with my blog, they're starting to maybe get a little bit of an understanding of exactly what maybe we've been dealing with for months now, because for months we've been trying to just make sure that we're staying as healthy as we can, trying to not put ourselves in contact with anything, and then boom, we get hit with this thing, and so I think a lot of people now, there's kind of a built-in empathy maybe that has occurred now between with my family and friends, and it's almost like they get it a little bit more. But absolutely, the platform that I'm able to blog and people can read and catch up with me, it's definitely made them understand a little bit more about what it is we've always been dealing with.
For more information about the Cancer Emergency Fund you heard Susan talk about, you can call 1-888-409-4166. The Cancer Support Community has also set up a website with information and resources related to COVID-19 for cancer patients and caregivers. You can check that out at cancersupportcommunity.org/coronavirus.